This is the Fix Your Sciatica podcast.
All right, and welcome back. Over the past few episodes, we've been looking at the brain and the psychology of safety, especially when it comes to sciatica pain and pain itself. But in order to truly understand why your legs feel like they're on fire, or why your foot can feel like a lead weight, or the pain is just unbearable, we have to look at the hardware and the anatomy of what's going on, as well as the physiology as how things are working. So today we're going to be taking a deep dive into both the anatomy and physiology of the sciatic nerve. And so whether you're in the middle of an acute flare-up right now, or you've been battling with chronic pain for years, understanding the map of your nervous system is actually going to be the first step in reclaiming control over your recovery. So the first start is, where does the sciatic nerve actually begin? Well, most people think that the sciatic nerve actually starts in the lower back and then exits your spine, but the truth is it starts in your brain. Specific areas include the primary motor cortex, which handles movement, and the somatosensory cortex, which handles sensation, actually sends signals down through the brainstem, and from there the signals actually travel down the spinal cord, which is essentially the superhighway of your body, protected by your skull and spinal column. As that highway actually reaches your lower back, though, it actually branches off. And so the sciatic nerve is actually formed by the nerve roots exiting L4, L5, S1, S2, and S3. And these individual nerve roots actually exit the spine and sacrum, and they meet at the level of your pelvis, and then they actually bundle together to form the sciatic nerve, which is the largest and longest nerve in your body. And it runs deep underneath your glute, down the back of your thigh, and then in just above the knee, it actually splits into two other branches, which includes the tibial and the fibular nerves, or the peroneal nerves if you are like to be old school. These actually cover almost your entire lower leg. And to be clear, if you ever have pain anywhere from the low back, skipping the butt, into the hamstring, and anywhere below the knee, that's often the path of the sciatic nerve. The only part of the lower leg that it doesn't cover is going to be the medial ankle, or the inside of your ankle, and that area is actually handled by the saphenous nerve, which actually comes from your femoral nerve, which supplies the front portion of your thigh. So, before we talk about how the nerve works, we have to talk about what nerve pain is. Now, again, nerve pain is actually just an irritation at any point along the path of the nerve itself, or in some cases even your brain, which is why in some cases doctors will prescribe central nervous system activators like gabapentin, and we have another episode all about gabapentin, and I can put that in the show notes. But number one, the nerves actually function, number one, through sensation. This is going to be your input, and it handles touch, heat, cold, pressure, and vibration. It sends signals up through your brain for you to register, what am I feeling? The second control is what we call motor control, and this is your output. It controls the muscles, specifically your hamstrings, your calves, and the muscles that move your ankles. So this is exactly why I asked you to walk on your toes or your heels, because it's one of the fastest ways to see if the output signals are being interrupted. The third function of your nerves includes autonomic control, and this is what we call the behind the scenes stuff. It will actually control blood flow, skin temperature, and even how much you sweat or how much oil is being produced on your skin. So we have to look at the sensations as a spectrum, and also nerve pain as a spectrum as well. So this is where we have the opportunity to decode the alarm. So we shouldn't be looking at nerve pain as an on and off switch, although I wish that was the case. I can just turn things off. We have to look at it as a spectrum. And depending on how irritated the nerve is, the sensation will actually change as well. So let's break down that spectrum from the most severe to the least severe. So if we're looking at the most severe irritation, we're looking at complete numbness. This is what I like to call a total blackout of sensation. The pathway between the area and the brain is blocked due to some sort of lesion, mechanical issue. So it's like if you touch your skin and you can see that and you can actually feel yourself touching with your finger, but you don't feel anything on your leg, the nerve is heavily compressed or irritated. We then move to the next spot, which is what we call tingling, or the falling asleep sensation. Many people think that this is often a circulation issue, but if your skin is properly moisturized and warm and your skin is intact, your blood flow is most likely fine. Tingling often means that there's a disruption in the signal, but it's not a total blackout yet. We move on into the next stage, which is burning. And this is like a constant searing type of burning pain. It's often triggered by a position like standing or sitting too long. And you want to think about the nerve endings as being too hyped up and sending a constant alarm to the brain. Again, there's a little less irritation, so you're having that information transitioning from down your leg up to your brain. But we are definitely not as irritated as the numbness, but also burning is an uncomfortable sensation. And to be clear, there is an opportunity for things to be burning like your muscles, but if you're sitting there, your muscles are burning, that's a different scenario compared to if you were exercising and your muscles were burning. We then move on into sharp shooting pain, which is going to be that classic lightning bolt. This usually happens when the nerve fibers are firing because of a true mechanical block, like a disc herniation, stenosis, or localized inflammation that could be pinching the signal as it's trying to pass up through your brain. We then move on into soreness and achiness, and this is actually a sign of healing. We know that the nerve is still irritated, but the emergency setting is actually chilling out. It can also be a byproduct of your muscles finally waking back up after being guarded for so long. It's like holding a bicep curl or holding a plank for a long period of time. You are going to be tired as a result, which then leads into what is called heaviness and tightness. And I like to call this the t-shirt sensation. You know that it's there just so that you know you're in fact wearing a shirt, but it's no longer dangerous or agonizing or irritating you. And this is often the remnant of some irritation as the damage finishes repairing and you're getting better. So, which means, how do we know we're actually getting better? So if we only look at the pain of is it there or is it gone, we are going to be missing a lot of the progress. So I identified a checklist for improvement. Number one is going to be your intensity. We want to make sure we're moving from a 10 out of 10 down to a 6 or even closer to 0. The second idea is what we call localization. Does the pain actually shrink in size? Does it go from your entire leg to just a specific point on your butt? The third point, which is often overlooked, is actually going to be called centralization. And I think this is one of the most important signs in terms into improvement. Because if your foot pain disappears, but your hamstring starts hurting more, as uncomfortable as it may seem, this is actually a win. It means that the pain is moving more central towards the spine. And I like to call it the toothpaste analogy. Number 4 is going to be called your sensation shift. So if your symptoms actually move from that like numbness and tingling to sharp, to an ache, to tightness, you are heading in the right direction. So my recommendation or your homework as you listen to this is to go back to your pain journal. This week, don't just write it hurts, but write down the flavor of the pain. Is it a blackout, numbness? Is it electricity, that shooting sensation? Or is it a heaviness, a tightness? Find that pattern. Does the flavor change when you sit? Does it change when you walk, to stand, bend over? How does everything behave? Because next week we're actually going to take those patterns and then use them to find the exact treatment that you need. Any questions, you can always reach us at info@ifixyoursciatica.com.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.